So we're going to move on to our next question, which is really exploring that piece around police violence and law enforcement very specifically. So this is actually a question where in some of our early conversations, Nana asked this question, which we thought would be good, a great question for all of you on the line. So we'd like to know, in your organizations, what kinds of relationships do you have with law enforcement, with police, with the criminal justice system in general? And so if you can share that in the chat box, we'll go into the next question, and then I'll come back and take a look at some of what you are sharing in the chat box. So the question is, what is the relationship between your organization and law enforcement? I think we just heard from Nana about that example of how, CAS comes in and apprehends, right? So they're all the systems which are we're all interacting with. Thank you. So we're going to move on here. And Nana, I'm going to get you to get us started with this question. So we'd like to know just from the context of police violence, how does this show up in the lives of communities and what impacts does it have?
Yes, can everybody hear me?
Yes, we can.
Awesome, okay. So I think Natisha did mention, some of the impact on Black people, specific with the police, and that was some research that was done by the Ontario Human Rights Commission in relation to the Toronto Police Services. So that, they found that Black people were nearly 20 times more likely than a white person to be involved in a fatal shooting. That research, echoed so much of what our community had been saying for decades, so many years about the violence that we were facing. I know that's just Toronto Police, but, it's likely that that can be extrapolated to other police forces. We were also overrepresented in use of force cases, so it might not necessarily result in a death, but it's serious injury. We were also overrepresented in SIU investigations, so Special Investigation Unit investigations, in which it was found that the police did not cause civilian injury or death. So we're overrepresented in the amount of violence afflicted against us, but also overrepresented in cases where they find the police, did not cause death or injury. That's quite problematic. We also see manifestations of it when it comes to gender. So for Black women, we had a higher rate of police investigation than white females or females from other racial backgrounds. So that's also another concern there. We've heard recently of the cases in Toronto of, Regis Korchinski-Paquette and Ndumbe-Eyoh Campbell. There's also Jamal Franzik, and the last two names I mentioned, they were killed by Peel police, so not necessarily Toronto police in Ontario specifically. But I think it's really key to see that it's not just the extreme cases that we hear. It's not just police killings, but it's overall serious injuries. We also know about cases where, Black women are overrepresented in terms of sexual assault enacted by the police. So that can, range from a variety of examples. But I think it's important that, the impact of this, again, is fear. It's a sense of distrust. It's a lack of confidence in the systems that are meant to protect us and in the systems that are meant to hold police accountable for that violence, right? So I think it's important to think a little bit about how those impacts are, racialized, but also they may intersect with gender. When we think about Regis Korchinski-Paquette and Ndumbe-Eyoh Campbell, they also were experiencing, from what we know, mental health crises. And in Ndumbe-Eyoh Campbell's case, he's the one who called the Peel police and sought help. And he ended up, dead at the hands of the police. So I think it's really important that we think about the different kinds of intersections and how they manifest when it comes to police violence for our people.
Great, and thank you, Nana, and thank you for sharing those names and concrete examples of Black men and women and gender diverse people, really, who have had this interaction. I think one of the things you're really highlighting for us is that a lot of what we're seeing in the media right now is around killings, which are critically important, but you're also outlining the different ways in which the police enact violence. And we're hearing about some very individual examples. If you think about this as a structural piece, and Nanya, early on you spoke about this culture of fear. So all of these individual names are in my mind are just, in a sense, are just the tip of the iceberg and speak to a really deeper problem. Thank you, Nana. Natisha, can you get in here and just share what you are seeing? So I know some of your work has been with the Toronto Police Services, and so what are you seeing there, and what kinds of shifts are you trying to work for?
In terms of, thank you, Nana, for giving us a fantastic overview of some of the situations that we're dealing with in terms of police violence and anti-Black racism. My work with Toronto Police Services, which is very active and is about to wrap up, has been with respect to Andrew Loku and the inquest that followed his killing by Toronto Police Services when he was having a mental health crisis. They arrived at the mental health support facility that he was living in and shot him within seconds upon arrival. What the inquest outlined was how anti-Black racism and its intersections with mental health amplify the response that police are having when we are calling for help and assistance, but instead are met with fatality and death. My role is to chair a panel which is reviewing all of the recommendations that came out of that inquest in terms of helping to reform Toronto Police Services and the manner in which they engage with Black communities, as well as those of our community members who are dealing with mental health issues. It has been an uphill battle because I think the biggest challenge has been to convince the police that the statistics that Nana has outlined are real. The experiences that we're having in terms of anti-Black racism from the police are real. We've been talking about this and advocating and fighting for change for over 30 years in policing. But there's still this belief that the statistics are wrong, that we are not to be believed, and that Black people are actually a criminal element in our society that must be contained. And so that's a long history of building that sort of belief, not just within policing, but within society as a whole. And one of the things that are very evident to me in my work is this understanding that when Black people actually, or Black communities actually need support, often the criminal justice system is what is sent in first. My many years working in public health, particularly around HIV and HIV surveillance, is a clear example where when the HIV pandemic happened in Canada, Black people were overrepresented in the statistics and those that were contracting HIV. Instead of addressing what were the drivers that created that scenario where Black people in Canada are overrepresented in all HIV statistics, what we see is the criminalization of non-disclosure of HIV. And who is overrepresented in that criminalization of HIV non-disclosure are Black men in particular, but Black people as a whole. And for me, it was always a clear-cut example of how we become criminalized in every element of society that we engage in and that we are having difficulties in because of the social determinants of health. And there's no coincidence that you would also see the level of violence that we're experiencing with police services across this country and globally, because it's the understanding and psychology that has been imprinted on our society that Black people are criminalized and must be controlled and contained. And as we've seen over the last 3 months, killed. So I'll end my comments there.
Thank you for that, Natisha. As you were speaking, what was coming to mind for me is I think you're really stressing this idea of Black people as inherently dangerous and how it's such a deep-seated way. It's such a deep-seated idea, not just in Canada, and yes, in Canada, but really across the globe, even in places where you don't really visit Black people. Those ideas have really have traveled the world, have traveled the globe, and we're seeing and we're living with the very real outcomes of that. And as we get to the last question, again, I'd like to hear ideas, all three of you, of how do we undo some of that, or better yet, how do we undo all of that? We're talking about deep histories here, so thank you, Natasha. We're going to move on to Gaynor. Gaynor, would you like to add some comments in here about what you're seeing as the manifestations and impacts of anti-Blackness and police violence in the Canadian context? Gaynor, it's off to you right now. If you're speaking, we cannot hear you, but you can unmute yourself using #6. Okay, so we're not hearing from Gaynor there, so we'll just keep moving here, and if Gaynor comes back on, we will we'll continue. That we may have lost her there for a second. So while we're waiting for Gaynor to get back on here, Nana and Natasha, you've had a chance to hear each other respond to this question. Are there anything else, you'd like to add? All right. Hi, Gaynor.
Hi. Can you hear me?
Yes, we can.
Okay. Sorry about that. Technical difficulties. Do you want to go ahead or do you want to move on?
Please go ahead. Thank you.
Okay. I don't actually have much to add to what Nana and Natasha have outlined. I think they've done a beautiful job of sort of giving us a complete sense of what those impacts are. And I probably, as the conversation goes on, we'll talk a little bit more about why I've not been directly involved in this conversation, and it's in part because, you know, data around police violence as a health outcome is not something that we've routinely been collecting, certainly not from a public health perspective in Nova Scotia, but more on that later. When I think about manifestations, though, you know, I think what I would point to is similar to what I talked about in the first question, just for folks to be aware again of what those more subtle manifestations of violence are that aren't necessarily leading to outcomes such as hospitalizations and deaths or injuries and deaths, but they are nevertheless leaving an indelible mark on Black communities. And I think it's something like this. If you are already dealing with a community that in its context surrounded by a majority white community, therefore is constantly being subjected to power over, the additional presence of an armed officer in that environment is a new level of power over that can ultimately create terminal consequences. And I think given the history the Black communities have had with police and with the law enforcement agencies in our country, and given the overrepresentation that Nana and Natasha have so beautifully described of Black people in so many negative outcomes, you can understand to some degree how that additional presence now of an armed officer, that additional notion of being surveilled, of being constantly watched, of being expected to be, you know, dangerous, creates a stress that in and of itself has its own impact. And so again, it's another thing that I wouldn't want to leave the conversation without pointing out, that there doesn't necessarily have to be physical scars to state that there have been impacts from police violence in any given community. I think the way that those interactions have played out so many times repeatedly in Black communities across the country, and in addition to all of the other sort of power imbalances that are set up when you have those presence of a force with such a lethal means available to it, when that's present, you know, I think there's all kinds of additional harms for communities that, again, maybe are not as well captured as they should be. So that's all I would add to the conversation.
Great, thank you, Gaynor, and thanks for bringing that in. One of the documents which we shared with participants as on our webinar page is a policy statement from the American Public Health Association. I think it does. It was written in 2018. So in many ways, I think what some of the things put forward they need to move to catch up with the current conversations. But they do a pretty good job in that policy statement of outlining some of the evidence of the impact. And I want to point out a few things around just the psychological violence, which Gaynor is really speaking to, which impact communities not just on an individual level, but also at a neighborhood level. So what we're seeing here is that in neighborhoods where there's increased use of force, so really high police presence, that we're seeing elevated levels of psychological distress among the men who live in those neighborhoods. Also, there are really clear associations between perceived racial discrimination and risk factors for chronic disease and early mortality. And I think for folks who, as Nana mentioned, live in communities and live lives which are over-surveyed, you can see how that impacts communities in really deep ways. And one of the things about surveillance, I know that has come up in different ways from three of you, is it seems to me like communities are surveyed for the wrong things, and when we need information to actually drive change, there's this profound resistance. So when communities ask for information which actually improve lives and increase accountability in different systems, we've seen resistance. So when we come again to that last question, I'd like us to, if we go there, I'd like us to touch on that for a little bit. So thank you. I'd just like to share a few comments coming in from participants. So we asked you that question earlier about what relationships your organizations have with police. I see someone sharing here around HIV, particularly around criminalization, which really reflects what Nautisha shared earlier. We're seeing a comment about police calls for people with mental health, which again we've touched on. And really my question there again is, are police equipped to deal with this? I think the answer is clear, they are not. And why would we be calling police when we can have a more robust mental health system to actually provide communities with the support which is needed? So thanks for sharing those examples. Some people saying they don't really have ties to the police, and others saying they have partners. One comment I just want to read here, which is resonating with me, is saying we have partnered with law enforcement to solve whole of community solutions and avoid incarceration in lieu of solving the root problems. And I think that really speaks to the heart of what we're trying to get at today, which is what responsibilities have we given up to police, which really should be firmly in the hands of communities and in other sectors. So without further ado, I think that takes us very nicely into our last question, where we talk solutions. Oh, but before we move there, I just want to remind us all, in case you all forgot, that we're still living in a pandemic, and in a sense, in a syndemic. For those of you who joined some of our conversations on COVID-19 and equity, I think we raised this idea of policing, and we're seeing it very clearly, right? So again, this is not something which is new to communities. We're seeing here that in COVID-19, under public health mandates, really, police are targeting black communities. So this is in London, UK, where black folks are more likely to be fined under those laws than whites in London. The same thing holds true for New York City, and in Canada, we're not really collecting that information. So it's important that we have that, so that we have that accountability. And I would say that with or without that information, we actually do know what needs to be done right now.